Well, this is a microscopic view of the cells in the myocardium, and here we're looking at one of the individual nuclei, another nuclei. These are the nuclei within the cardiomyocytes, the individual myocardial cells, and we see there is a striated appearance to the muscle, similar to skeletal muscle. But here we see the intercalated discs, and the intercalated discs divide one cardiac cell from another, but allows free transmission of electrical impulses from one cardiac cell to the other, so that the cardiac impulse can be transmitted across the myocardium to allow coordinated contraction. The individual cardiac cells are interconnected as well, with little side branches to allow easy conduction of the electrical impulses across the myocardium. It forms what's called a syncytium, syncytial electrical transmission across the myocardium, all under the control of the sinoatrial node in the right atrium, which dictates the pace of cardiac contraction. You see another view, the intercalated discs, nuclei, intercalated disc between two cardiomyocytes. This is lower magnification again, and we can see many cardiomyocytes joined together, forming the myocardium, cardiac muscle cells. Lower magnification again. Here we see a coronary artery being perfused with a radio-opaque dye, and we can see the coronary artery being illuminated to identify any possible blockages caused by atheroma into the lumen of the coronary artery. This illuminates nicely the anatomy of the coronary arteries. You can see an obstruction in that one there, it's quite thin. And there we can see that a stenting procedure has improved the lumen of the coronary artery, improving the blood supply to the myocardium. Now here we're looking at a fetal ultrasound, a little unborn baby. See the vertebrae there. The head on the left. Amazing ultrasound pictures of the baby in the uterus. And there we could see the heart in the thoracic cavity. And there we see the fetal heart beating blood around the baby's body. If you look carefully, you can see the action of the valves, the contracting myocardium. Heart's going at a reasonably fast rate, of course, which is normal for fetal physiology. You can see the valves opening and closing between the atria and the ventricles. Amazing to think your heart's been beating for quite a few months before you were born.